So here's the last part of today's lecture. We're talking about a disease with an increasing prevalence all over the world. We're talking about food allergies. So what is food allergy? Food allergy is defined as an adverse health effect that occurs on exposure to a given food, and this happens repeatedly on exposure to this particular food. So the question would be, what's food? Food is practically anything. It is fresh veggies and fruits. It could be processed, semi-processed, or it could be any food, supplement, coloring, or additive. Adverse reactions to food could be divided into two very big groups. It's either immune-mediated reactions, which is our concern today, or it could be non-immune mediated, which is usually referred to as intolerances. Intolerances could be a pharmacological reaction, it could be a metabolic disorder, it could be food poisoning, for instance. These are all referred to as intolerances. Immune-mediated food allergies could be IgE in nature, and the best example to do this is when you take a particular food, so you get the severe rash, laryngeal spasm, intense vomiting, edema of the face, so it is an anaphylactic reaction. Non-IgE mediated, and the best example to this is the celiac disease. It could be mixed, or it could be cell-mediated immune response. And here are the culprits. These are the 8 big monsters that are usually held responsible for most of the food allergies. Milk and all milk products, wheat, eggs, soya beans, peanuts, tree nuts, crustaceans, and fish. In cases of food allergy, usually if you take a detailed medical history and you do some focused physical examination, this will help you to reach the diagnosis. This is the rule in any food allergy. Sometimes you might need to select few appropriate tests that might help to support your diagnosis, but these tests also have their own limitation. There is one very clear limitation that I've just mentioned. I hope you can remember. So the golden rule in diagnosis of food allergies is to eliminate the food that you suspect to be responsible for this clinical presentation, and when the patient reaches his baseline health status, to re-challenge by introducing this very same food once again. So what can we do if we diagnose a patient with food allergy? If you diagnose a child with food allergy, there is only one way here. He should avoid ingesting the food he's allergic to. And during this period, you should provide adequate nutritional counseling and regular growth monitoring. You should educate and train the child and the parents to read the ingredient list on food, and any product where there is the label of this product may contain trace amounts of should be avoided. So the question is, for how long will the child eliminate the food he's allergic to? The answer is 1 year. You are justified to test for tolerance after 1 year of elimination of the suspected food. And the most important thing here is that no medications, no vaccinations are there to prevent IgE or non-IgE mediated food allergic reactions. Nothing. If you diagnose food allergy, the only thing you can do is to stop the offending food and then test annually for tolerance to check if the child can tolerate this food or not yet. And now I come to the end of this lecture. I'm eager to have a very fruitful brainstorming discussion with all of you in the face-to-face session. Thank you very much.